So good morning. My name is Fatima Makram. I'm a second year BPT student. Today I am going to explain you about the clinical uses of shortwave diathermy. So let us start. What is shortwave diathermy first? So it's a therapeutic modality which produces the deep heating by converting the electromagnetic energy into the thermal energy. Now, therapeutic frequencies and wavelengths. So, common one is 27.12 megahertz with 11 meter wavelength, and less common ones are 40.68 megahertz with 7.5 meter wavelength and 13.56 megahertz with 22 meter wavelength. So, principles of diathermy. So, this SWD works on the behavior of the dipole molecules, which is present within the body tissues under an electric field. So in healthy tissues, these dipole molecules are arranged in an orderly and polarity-based pattern. In the injured tissues, this dipole distribution is irregular and deviates from its original polarity-based alignment. Under the influence of the electric field, this dipole rotates along the field lines, realigning and restoring their normal polarity state. So the physiological effects of the SWD. So SWD produces the deep heating, and heating is not uniform. It depends upon the tissue composition. So key principle: tissues with high water content and iron content, like muscles, can absorb more heat as compared to the tissues like fats, which does not have much water and iron content. Therapeutic uses of SWD. From inflammation to pain relief, SWD serves multiple roles across the subacute and chronic conditions. Effect on the inflammation, vascular effects. So it causes the vasodilatation, as heating causes the vasodilatation. Increased blood flow, nutrition, metabolic effects also are increased, and antibodies and WBC delivery is also increased. Promotes exudation, followed by the absorption and waste removal. So swelling is also reduced as the exudation is removed. Acute stage, avoid the use because vasodilatation and fluid exudation is already present, which could worsen the condition. Subacute stage, stronger doses can be applied to support the healing, and in the chronic stage, long duration doses should be applied for sustained therapeutic effect. Now, effect on the bacterial infection. SWD is useful in the conditions like boils, carbuncles, and abscesses. Augments immune response, enhances the body's inflammatory response to bacterial presence. Improves healing. With free drainage, stronger doses improves blood supply and accelerate healing. Does not directly kill the bacteria. Bacterial destruction can be done with the high temperature. So, traumatic conditions and reduced healing time. Trauma. Treated with the same principle as inflammatory conditions, avoid use in the early stages. Stiff joints. Stronger doses can be applied in case of the stiff joints, which improves the joint ROM and improves the mobility and reduces the stiffness. Wound healing. Increase the blood supply. The SWD increases the blood supply, so it increases the oxygen and nutrient supply to that part, and it promotes the tissue repair. SWD accelerates healing across the traumatic and post-surgical conditions by enhancing circulation. So this circulation is enhanced, as well as the healing process is also enhanced because of the vasodilatation and more blood supply. And also the metabolic activity at the tissue level is increased. Pain relief and effect on the muscles. So sedative effect, mild heating calms the nerve endings and reduce the pain perception. Nociceptive perception is reduced. Waste removal improves the circulation, clears the metabolic byproducts, and clears the waste. Counter irritation. So pain gate theory works in here where the thermal stimulations are increased and pain simulations are suppressed. And muscle relaxation relieves the muscle spasm associated with the trauma and upper motor neuron disorders. So summary of the clinical uses. Musculoskeletal disorders like osteoarthritis, rheumatoid arthritis, sprains, strains, hematomas are cured. Inflammatory conditions like boils, carbuncles, sinusitis, infected incisions. Other conditions like pelvic conditions, joint stiffness, wound healing. SWD produces deep heating, preferentially in high water content tissues like muscles, and there is according to the dielectric constant. Dosing must be adjusted with the stage of condition, subacute and chronic. Effective for pain, inflammation, infection support, and muscle spasm. Does not directly destroy the bacteria but supports the immune response. Always assess tissue type, condition stage, and contraindication before applying the SWD. As we all know, contraindication is first. So, this is it. Thank you.